Taking a break from cooking to talk about something very important. This time of year can be a really busy time with families, back to school, after school activities, sports, etc. And for many women, taking care of ourselves can be put on hold. Joining me now to talk about women getting in to see their doctors and the importance of it, Dr. Scott Weslow from Aurora Baycare Medical Center. Good morning, doctor.
Good morning, Amy.
Thanks for being here.
Glad to be here.
You bet. So I am one of those people who, needs that reminder every year to get in for my annual checkup. It seems like we put everybody else before, and I run around like crazy people these days, and that's not a good idea.
No, and it's not unusual for anybody to put off doctor appointments, but especially women seem to be doing that a lot these days.
Heart disease among women is really a huge concern, and a lot of people don't realize that.
Right. Heart disease is the #1 killer of women in the United States, and a lot of people don't realize that. Actually, a study we just looked at of 1,000 women, 45% of women did not realize that.
And you say so many women put off going to the doctor, not only because they're so busy, but a new study shows there's a lot of other reasons that we are, kind of put that off and are scared to go.
Right.
Let's talk about that a little bit.
Well, kind of a surprising statistic from that study was that many women put off seeing their doctor. 63% were putting off doctor appointments, but of those 63, 40-some% were doing so that they could lose weight before they see their doctor.
That sounds familiar. They don't want to get on that dreaded scale.
Right. Yeah.
How often should we actually be seeing our provider?
At the very least, you need to see your primary care physician once a year. And then your primary care physician decides what specialists you might need to see based on your risk factors.
You talked a bit about heart disease and how it's such a concern for women. What are some of the symptoms that people should not ignore? And that's another thing. I think a lot of us ignore things until they become too late, or
right.
They could have been caught early.
Correct. So we all know about chest pain. Don't ignore chest pain. Pretty much everybody knows that. But what a lot of people don't understand is that women oftentimes don't feel chest pain with their heart attacks.
Okay.
They feel other symptoms like lightheadedness, dizziness, nausea, fatigue, shortness of breath, things like that. So you really shouldn't, if you're not feeling right, you really shouldn't ignore that anytime. And when you look at women who've had heart attacks and you ask them in retrospect, were you feeling anything? And the most common symptom that people said was, I just wasn't feeling myself. So don't ignore that.
Yeah, absolutely. It may not be heart disease, it could be, but it could be something else. So bottom line, get in there, see your provider, don't put it off.
Exactly.
How can people find out more information?
Well, you can go to our website, and I believe Fox 11 is going to have some information about what we talked about today on their website, and really see your doctor, and they can really mainstream things from there.
Absolutely, and we'll put a link to aurorabaycare.com. Dr. Scott Weslow, I know you're a busy guy. We'll let you get back to doing what you do.
I appreciate being here.
Yeah, thanks so much.